Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day, to your week. And we got some interesting topics this week. And Wendy, good morning. And Brahim, good morning. Lisa, Mike, good morning to you. Nice to have you on. Charlotte and Dorita. Diane, how are you doing? And Lisa. And Kim, good morning. And Jovi. I like that. That's a nice name, Jovi. John, how are you? Elgin, Illinois, our friend. Lisa. Andrea, Niagara Falls. Kristen. And Nick from our staff. Nice to have you on. Mitch from Sturgeon Falls. Peggy. Jocelyn, Sturgeon Falls. And our friend Wendy, good morning. Jean. And Sherry. Did you miss me Friday, guys? Somebody said we missed you. I forgot. I didn't do Friday. Ziane. Bonjour. Marilyn. And Jeanette from our staff. Francine. Nikina. And Venerance. I like that too. Hazel. Catherine. Anybody on here this morning? William, good morning. Danuta. Anybody on here this morning, first time? Well, good morning to you. Annette and Emily. We appreciate it. Colleen. Kathy. Good morning, Kathy. How are you? Joan. Okay. And David from Florida. Wow. And Jean, Ermi, and Mandy, Diane from LaSalle, and Joe, LaSalle near Windsor, of course. Joe and Maria from London, Susan, and Leanne from Kitchener, Dorothy. Good morning, guys. And like I said, if there was a few people might have been trying to tell me that. Todd, good morning. AJ, how are you? Dorothy. Okay, let's talk about this study came out. I think you'll find it interesting. It came out of the Journal of Clinical Sleep Medicine. The Journal of Clinical Sleep Medicine. I didn't know there was such a journal until I read this study. The Journal of Clinical Sleep Medicine. Now, it should not be surprising that there's actually a journal on sleep. When you consider, this is, sometimes I don't know, would we underestimate, or how would I use, what term am I really looking at? Some things are unbelievable. They're astounding almost. And it's just because we don't talk about it so much, except here, of course, but I always talk about sleep. Big part of your health. And I'm gonna show you a study that came out of this journal that says exactly that. Now, here's the statistic that is astounding. 70% of the population have some form of sleep disorder. They don't sleep well. It's not just, you can get a night here and there that you don't sleep well. That happens. But that's not what we're talking about. We're talking about people that consistently have trouble sleeping. 70% of the population consistently have trouble sleeping. Now listen to what the Journal of Clinical Sleep Medicine says. 22% of men, and this is crazy, and 17% of women in North America don't only have sleep disorders, because that's 70% of the population, but 22% of men and 17% of women have sleep apnea. Now that's another disorder altogether, isn't it? Sleep apnea is very dangerous because it's hypoxia. It's a lack of oxygen going up to the brain. I mean, more than almost a quarter of all men in North America, according to this journal, have sleep apnea. They don't only have trouble sleeping. They've got sleep apnea. They actually have low oxygen levels going to their brain. And almost 20% of women. And again, guys, I want you to put your thinking caps on. Why? I'm a why guy. Why when, like I'm telling you, you look at my medical books in the 1970s, nobody talked about sleep apnea. I mean it. There was, why didn't, you know me, I kind of laugh at myself because I wonder why. Why didn't I invest? If I was a prophet and I could see forward, wouldn't have we invested, or I would have invested in sleep apnea machines? My word. I told you I was traveling on Friday, and you know what they asked me at the airport? Do you have a sleep apnea machine in your carry-on? Like, what? No, but see, they're so used to asking the question. Do you have a sleep apnea machine in there? I said, no, I don't have that. I'm trying to think of what was on my carry-on that they were thinking might be a sleep apnea machine. And I think I realized it was my water pick for my teeth. I think. No, but it's so common. They're asking about it at the airport. Do you got a sleep apnea machine? Wow. What? Guys, now, what's happened? What in the world has happened that we have this sleep disruption? And it was interesting, reading through some of the articles in this journal. I mean, I'm going to focus in on one of them this morning. But like all the problems that occur with sleep apnea. Now, let me read you this study, and then we'll unpack it. Okay, here's the study. I told you the statistics. In sleep apnea, okay, new study out of the Journal of Clinical Sleep Medicine shows that sleep apnea causes leaky gut. What? Sleep apnea, according to the Journal of Sleep Medicine, sleep apnea it's one of the causes of leaky gut. And I mean, no wonder I flagged the study. Think about that. What? Sleep apnea is one of the causes of leaky gut. And here's what the study says. Here's what happens. You get a sleep apnea, a lack of oxygen to the brain. That's what the sleep apnea machine does, right? It just pours oxygen to the brain. But with sleep apnea, a lack of oxygen, hypoxia, okay, disrupts your microbiome. And here's how it happens. Here's what they said in the article. It's very interesting. When you have sleep apnea, you have low levels of oxygen. Lower levels of oxygen. Not no oxygen, but lower levels, right? Because that's what sleep apnea is. When that happens, you have certain bacteria. Okay, remember always the war that's going on inside your body. It's invisible. You have a war going on all the time. It's invisible. You don't see it, but it's very, very important that you see behind the scenes. This is why I try and talk to you a lot about leaky gut. It's one of the foundational, one of the 3 things that we talk about at Martin Clinic that is the seeds of disease. All disease, anything you can think of, comes out of these 3. One of the common ones is leaky gut. So the journal is saying in studies that when you have a low levels of oxygen, bad bacteria, certain bad bacteria flourish. They love the idea of no oxygen. Your good bacteria need oxygen. So now you get a medical term. It's called dysbiosis. You know what that is? Dysbiosis is you have more bad guys than good guys. And we know that that can happen with antibiotics. It can happen with a bad diet, sugar and crappy seed oils. And it can happen with a disruption of, even non-steroidal anti-inflammatories, people that live on Tylenol and Advil and painkillers and anti-inflammatories. I mean, they got pain, so they take that, but it disrupts their microbiome. That is, you got more bad guys than good guys. It means you lose. As a matter of fact, I think I'll bring this out in another study, because there was another study on the weekend that I flagged. I actually posted it on our private Facebook group on antibiotics and colon cancer. Did you see that? We'll unpack that maybe today even. Okay. So let me just put this into perspective. You get sleep apnea. You have low levels of oxygen. Okay? Low levels of oxygen. You have a flourishing of bad bacteria and a diminishing of good bacteria, because your good bacteria needs oxygen. When there's less, the bad bacteria thrive. So now you have a medical condition called dysbiosis. Okay? So here's the study. Sleep apnea causes leaky gut. And again, what is leaky gut? Very important to understand this. Leaky gut is not digestive issues per se. Okay? Because a lot of people have leaky gut, and we're going to talk about this. They don't have any digestive symptoms. It has nothing to do with, oh, doc, my gut is good. I go to the bathroom every day and I don't have any bloating or whatever. But that doesn't mean you don't have leaky gut. Leaky gut occurs. You have a junction in your gut, okay? So I'm showing you here your gut. And this is so microscopic, and you can just try and use your imagination. It's your epithelial cells. It's a border between your gut and your blood. You have a border there, okay? And that border is made up of cells, but the border guards guarding your gut and your blood are made up of bacteria. When you get dysbiosis, when you get an interruption of your microbiome, you have your tight, you see, your body is smart. When you eat, the only thing that should get into your blood, because you need to get your nutrients in your bloodstream, to feed yourself, to feed all your cells from your brain to your toes. You need nutrition. And your nutrition is micro-sized to the point that it can go through the junction of your epithelial cells. Okay? That's how micro-sized your food needs to be. And the problem is when you have not enough border guards, you get junk going into your bloodstream. And this is what they were saying with the study. Sleep apnea causes leaky gut. Leaky gut is when there's not enough friendly bacteria that help to protect your blood from garbage coming in. See, what your body doesn't need should go into the toilet. Think about that. But what happens in leaky gut? You get garbage in. Garbage is supposed to be out. Garbage gets into your bloodstream. Your bloodstream is supposed to be pristine. No pollution in the river. Your blood, you've got 60,000 miles of blood vessels. And your blood carries your oxygen. It carries your nutrients. But there's not supposed to be any garbage in there. Garbage belongs outside the blood and into the toilet. How do these bacteria and bad guys get into your blood? Undigested protein, only when you have leaky gut. And one of the ways you can get leaky gut is sleep apnea. Okay? The study, can you imagine? Here we are in 2021. And hello, medicine is finally waking up. Finally waking up to leaky gut. It means something to them. Because I didn't finish the study here. I gotta unpack this even more. What they're saying is, you get sleep apnea. It gives you leaky gut. And leaky gut, according to the study in this sleep medicine journal, gives you hypertension, high blood pressure. What? That was what they were talking about. One of the things they talked about. Of course, I've shown you over the years, there isn't an autoimmune disease. MS, Parkinson's, colitis, ulcerative colitis, Crohn's, Sjogren's, thyroid, autoimmune, Graves or Hashimoto's, rheumatoid arthritis, psoriasis. These are all autoimmune diseases, and every one of them comes from leaky gut. I want to unpack sleep apnea one more step because you've heard me say this, and I want to say it this morning again. Sleep apnea does not come out of nowhere. It doesn't come out of nowhere. Sleep apnea comes from high circulating insulin. It's the cause. See, because they didn't talk about the cause of sleep apnea. They just told us in this study how prevalent sleep apnea was. But they didn't talk about the cause of it. Maybe they're not even thinking about what causes sleep apnea. But we know what causes sleep apnea. It's food. It's insulin. It's what you've heard me say this. This is exclusive to the Martin Clinic. What do I call sleep apnea? Let's see if anybody is thinking with me here. What's the other name that I call sleep apnea? Let me just see here if anyone will scroll. I'll give you a second or two to answer it. What is Dr. Martin's other name? You got it, Brenda. You got it. Fatty tongue. So do you, Charlotte. Okay? You guys are unbelievable. You're so smart. Rosa, all of it. You guys are the best audience in the world. I was saying that to the other day to someone. I said, you wouldn't believe my audience, how smart they are. I mean, these people, they're smart. Fatty tongue. Fatty tongue. Fatty tongue is the cause of, is one of the steps in sleep apnea, but you don't get a fatty tongue because you talk a lot. You get a fatty tongue when you eat crappy carbohydrate, sugar. Fatty tongue. Fatty tongue equals sleep apnea. And that's why the reset. Again, I bring it back. Hey, guys, even in medicine, they're starting to catch on. They didn't say fatty tongue, but, not in this article, but they just talked about sleep apnea. Sleep apnea causes leaky gut. It's one of the causes of leaky gut. It causes dysbiosis, and that causes leaky gut. Your gut doesn't have the border guards that it needs to keep your blood pristine. And then you get inflammation. That's what they're saying. You get, bugs and stuff getting into your blood that shouldn't have got in there in the first place, and your body reacts to it, causes inflammation, and inflammation causes, hypertension. Now listen, inflammation, you know what we say all the time, it's not Houdini. Inflammation, and even in this journal, they're saying, inflammation only comes because the person has leaky gut. And leaky gut comes, not in every case, of course, but in a lot of cases comes from sleep apnea. Wow. So here's a person with high blood pressure. And I always did this in the clinic, by the way. In my clinic days, when someone had high blood pressure, I didn't just say, you got high blood pressure and, deal with it. I always would tell them why you have high blood pressure. And I always brought it back to insulin. That hormone, that lovely hormone, insulin. I mean, you can't live without it. But boy, oh boy, if you secrete too much insulin over a period of time, you can get sleep apnea. One of the branches of high circulating insulin. It comes back to food, doesn't it? It's your food. Food. Isn't it the foundation, guys? It's the foundation. So, think about this. Wow, what a study. And they talk about leaky gut and, I mean, if they don't teach this in medical schools today, they'll never get it. How you talk about important leaky gut, one of the seeds of all diseases. So it's incredible, guys, when you think about it. It's incredible. And let me just talk about that other study that came out. I have it right here on antibiotics. This came out on Friday, I believe, because I posted it for you on the weekend. Let me just see here. Where did I have it in my notes? Here it is. Okay. Antibiotics. Okay. And again, the greatest discovery of the 20th century. Antibiotics, well established. There would be no disagreement with this, that antibiotics kill your friendly bacteria and cause leaky gut. I don't think there's anybody that would argue that even for 5 seconds. Okay? And again, are we telling people not to take their antibiotics? Of course not. You need an antibiotic, it can save your life. I've always said it, but I've warned people for 50 years. I've been warning people about the double-edged sword of antibiotics. One of them, well established, is that bacteria are intelligent. Imagine. They communicate with each other, and bacteria, they develop a resistance to antibiotics. True or false? Of course it's true. You go to the hospital. Where's the most dangerous place in the world to go? I'm not telling you not to go. I'm just telling you this is just a fact, guys. The most dangerous place in the world to go is not Afghanistan. It's your local hospital. They have superbugs there. Why is that? It's the overuse of antibiotics. That medicine, they know it 100%. Because bacteria become superbugs when they become resistant to antibiotics. There's a bacteria, very, very common in the hospital, called C as in the letter C, difficile. I like it because it's easy to remember. It's very difficult. C. difficile. You know how you get C. difficile? Is when you go to the hospital. It's a hospital-borne bacteria. It's a superbug. And there's many variations now of C. difficile. And what the study is saying, because it goes back to your friendly bacteria, is when you take an antibiotic, in 5 days, you've destroyed your complete microbiome gonzo. You better replenish that. And don't worry about putting bad guys back in. You just make sure you get enough good guys. Because that's what that war is all about. The war, invisible war of your good and bad bacteria. And by the way, study just showed it again, something that I've been saying. Don't take antibiotics unless you have to, long term. A lot of women, especially, are put on antibiotics for a urinary tract infection, and they had no pain. It's just because when they did a urinalysis, oh, you got a urinary tract infection. Okay, is it killing you? Is it burning? Well, don't take an antibiotic. Take a probiotic. Don't take an antibiotic because you're just killing your friendly bacteria. And now it's going to come back with a vengeance. Secondly, and this is the new studies on antibiotics, guys, you take them as long as you need them and then stop. Because you know how they always said it for years and years and years and years and years. And it gives me a headache when I used to think about it. Because I said, well, it's not right. You're creating super resistance. They always said, and the pharmacists, well, you take this till it's finished. Brought to you by the pharmaceutical company that made it. Finish the dose. No. What happens? You're developing resistance. You're wiping out all your good bacteria. You're creating superbugs. You take an antibiotic as long as you've got symptoms. After that, stop. Stop. And so many women over the years, I saw it with recurring urinary tract infections. I said, will you stop taking the antibiotic? You might need it for a day or two, get rid of the burning, and I don't want that to travel up to your kidneys either. But you know what I'm saying? I've been so consistent about it. Now they're saying, yeah, you know what? You're right. You're right. It's hard to change the narrative. It's been so ingrained in our society, it's hard to change it. But here we are looking at this, and let me finish with this, because what they're showing is you disrupt your friendly bacteria, antibiotics, especially when you overuse them. You know what? Now you become very susceptible to colon cancer. I posted that for you the other day. I posted that study for you the other day on our private Facebook group. Hey guys, I didn't say it. Medicine said it. Like I said, antibiotics are wonderful, but they're a double-edged sword. So isn't that interesting, guys? The whole thing about sleep apnea, and I unpacked it even a little bit more for you today. And the gut and high blood pressure. What? Well. Yeah. Okay, so we got a great week coming up. We got some great studies that I think you'll find fascinating. And we'll go back to Friday, question and answer Friday. I think I'm going to I'll let you know a little bit later in the week, I'm going to do an afternoon session on Thursday rather than Thursday morning. I'm going to let you know that, okay? And the other thing is, it's November 1st. Are you ready for Christmas? Well, you get your books. Get the reset. It's the greatest gift you can give them. Okay? And if you're not, the new folks on with us, if you're not a member of our private Facebook group, please join up and you can bring your family and friends in with you. And for those of your friends and family that can't watch us live, you can share this on Facebook with them, or you can get them to download the podcast, The Doctor Is In podcast. Wow, that's a popular podcast. And again, it's all because of you guys. It's all because of you guys. And we appreciate it, okay? So we'll talk to you soon. We love you dearly.